Question 1. Assessment of a neonate presenting with ambiguous genitalia and dysmorphic features requires a precise cytogenetic evaluation. Given the potential for a range of chromosomal abnormalities, including aneuploidies, structural rearrangements, and submicroscopic copy number variations, which of the following diagnostic strategies best aligns with current best practices for postnatal cytogenetic analysis in this clinical context? Option A. Proceed directly to chromosomal microarray analysis, CMA, without an initial karyotype, as CMA offers the highest resolution for detecting copy number variations. Option B. Rely solely on fluorescence in situ hybridization FISH for common sex chromosome aneuploidies, as this is a rapid and cost-effective initial screening method. Option C. Perform a standard resolution G-banded karyotype only, as this is sufficient for identifying common aneuploidies and gross structural rearrangements. Option D. Initiate high-resolution G-banded karyotyping, followed by targeted fluorescence in situ hybridization, FISH, or chromosomal microarray analysis, CMA, if initial karyotype findings are inconclusive or raise specific suspicions. The correct answer is D. Initiate high-resolution G-banded karyotyping, followed by targeted fluorescence in situ hybridization, FISH, or chromosomal microarray analysis, CMA, if initial karyotype findings are inconclusive or raise specific suspicions. Explanation: scenario analysis. This scenario presents a common yet challenging situation in postnatal cytogenetics. The challenge lies in interpreting complex chromosomal findings in a neonate with ambiguous genitalia, where the genetic and phenotypic presentations may not align perfectly. Differentiating between a true chromosomal abnormality requiring immediate clinical intervention and a variant of uncertain significance necessitates a thorough understanding of cytogenetic principles, diagnostic criteria, and the potential clinical implications for the patient and family. The urgency of the clinical situation, coupled with the potential for significant psychosocial impact, demands precise and ethically sound diagnostic approaches. Correct approach analysis. The correct approach involves a comprehensive postnatal cytogenetic analysis, specifically utilizing high-resolution G-banded karyotyping, and if indicated by initial findings or clinical suspicion, fluorescence in situ hybridization, FISH, or chromosomal microarray analysis, CMA. This multimodal approach is best professional practice because it aligns with established guidelines for investigating congenital anomalies and genetic disorders. High-resolution karyotyping provides a global overview of chromosomal structure and number, crucial for detecting aneuploidies and large structural rearrangements. FISH is invaluable for confirming specific suspected abnormalities, e.g., sex chromosome aneuploidy, microdeletions/duplications, or for rapid screening. CMA offers higher resolution for detecting submicroscopic copy number variations, CNV, that may not be visible by karyotyping, which is particularly relevant in cases of ambiguous genitalia where subtle genetic influences can be significant. This comprehensive strategy ensures accurate diagnosis, informs clinical management, and facilitates appropriate genetic counseling for the family, adhering to the principles of patient-centered care and diagnostic accuracy mandated by regulatory frameworks governing genetic testing. Incorrect approaches analysis. One incorrect approach would be to solely rely on a standard resolution karyotype without considering higher resolution techniques or FISH/CMA. This is professionally unacceptable because standard karyotyping may miss smaller deletions, duplication, or complex rearrangements that could be clinically significant, especially in the context of ambiguous genitalia. Failure to employ the most sensitive and appropriate diagnostic tools can lead to an incomplete or inaccurate diagnosis, impacting patient care and genetic counseling. Another incorrect approach would be to proceed directly to CMA without an initial karyotype, especially if a significant structural rearrangement is suspected. While CMA is highly sensitive for CNVs, it may not accurately characterize balanced translocations or inversions, which can be critical for reproductive risk assessment. Relying solely on CMA in such cases could lead to misinterpretation of findings and inadequate counseling regarding inheritance patterns and recurrence risks. A third incorrect approach would be to delay comprehensive cytogenetic analysis based on initial clinical impression alone, or to rely on non-cytogenetic genetic testing without a clear indication. This is ethically and professionally problematic, as it deviates from established diagnostic pathways for suspected chromosomal abnormalities. Delaying definitive cytogenetic analysis can hinder timely clinical management and parental decision-making, and using inappropriate testing methods can lead to misdiagnosis and unnecessary anxiety. Professional reasoning. Professionals should adopt a systematic, evidence-based approach to postnatal cytogenetic analysis. This involves 1. Thoroughly reviewing the clinical presentation and family history to formulate a differential diagnosis. 2. Selecting the most appropriate initial cytogenetic methodology based on the suspected abnormalities, e.g., karyotyping for aneuploidies and gross structural rearrangements, FISH for specific gene deletions/amplifications, CMA for subtelomeric or intragenic CNVs. 3. Interpreting results in the context of the clinical findings and known genotype-phenotype correlations. 4. Consulting with clinical geneticists and other specialists as needed. 5. Providing clear, comprehensive, and ethically sound genetic counseling to the family, addressing diagnostic uncertainties and implications for future reproductive planning. This decision-making process ensures diagnostic accuracy, patient safety, and adherence to professional and regulatory standards. Question 2. Comparative studies suggest that the impact of genetic test results on patient understanding and decision-making is significantly influenced by the quality of pre- and post-test counseling. In a scenario where a CLSp, CG, has identified a pathogenic variant associated with an increased risk of a hereditary cancer syndrome, which of the following approaches best addresses the patient's needs and adheres to professional and regulatory standards? Option A. Present the raw genetic data and explain the statistical likelihood of developing the associated cancer, advising the patient on immediate lifestyle changes they should implement. Option B. Provide a detailed report of the genetic findings, including the specific variant identified and its known association with the cancer syndrome, and offer a referral to a geneticist for further management and discussion of implications. Option C. Inform the patient that the identified variant is a significant finding and suggest they discuss it with their primary care physician without providing further context or resources. Option D. Deliver a simplified summary of the genetic result, focusing on the most common outcome associated with the variant and omitting discussion of less frequent but possible scenarios. Correct answer is B. Provide a detailed report of the genetic findings, including the specific variant identified and its known association with the cancer syndrome, and offer a referral to a geneticist for further management and discussion of implications. Explanation. This scenario presents a professional challenge due to the inherent complexity of genetic counseling and risk assessment, particularly when dealing with potentially life-altering information for patients and their families. The CLSp, CG, must navigate the delicate balance between providing accurate scientific information and ensuring patient comprehension and autonomy, all within the strict confines of regulatory compliance and ethical practice. The impact assessment approach is crucial here, because it requires the specialist to consider the potential consequences of their actions and communication on the patient's well-being, decision-making capacity, and emotional state. The correct approach, which involves a comprehensive genetic counseling session that includes a detailed explanation of the genetic findings, their implications for the patient and their family, and a thorough discussion of available options and resources, represents best professional practice. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, autonomy, respecting the patient's right to make informed decisions, and justice, fair distribution of resources and care. Specifically, within the U.S. regulatory framework for genetic testing and counseling, the CLSp, CG, is expected to adhere to guidelines that emphasize informed consent, patient education, and the provision of support services. This approach ensures that the patient receives not only the scientific data, but also the context and guidance necessary to process this information and make informed choices about their health and reproductive future. An incorrect approach would be to simply present the raw genetic data without adequate explanation or context. This fails to meet the ethical obligation of providing sufficient information for informed consent and decision-making. It also neglects the principle of beneficence by not offering the support and guidance necessary for the patient to understand and act upon the results. Another incorrect approach would be to offer definitive prognoses or recommendations without acknowledging the probabilistic nature of genetic risk and the limitations of current scientific knowledge. This violates the principle of non-maleficence by potentially causing undue anxiety or false reassurance, and it oversteps the CLSp, CGS role by venturing into medical diagnosis or treatment advice, which typically falls under the purview of a physician or geneticist. Furthermore, failing to offer appropriate referrals to geneticists, genetic counselors, or support groups represents a failure in providing comprehensive care and respecting patient autonomy by limiting their access to further specialized assistance. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's needs, the scientific information available, the relevant ethical principles, and the applicable regulatory requirements. The CLSp CG should prioritize clear, understandable communication, patient-centered counseling, and a commitment to ongoing support and referral as needed. This involves active listening, empathetic engagement, and a continuous assessment of the patient's comprehension and emotional response throughout the process. Question 3. Process analysis reveals that prenatal sample exhibits a specific chromosomal rearrangement. While this rearrangement is known to be associated with a spectrum of clinical outcomes, its exact impact on fetal development is not always predictable. Considering the CLSp, CGS role in interpreting and reporting cytogenetic findings, which of the following approaches best reflects the professional responsibility in this scenario? Option A. Report the chromosomal rearrangement and provide a definitive prognosis for the child's future health and developmental trajectory based solely on the cytogenetic result. Option B. Report the chromosomal rearrangement as a benign finding, assuming it has no clinical significance without further investigation. Option C. Report the chromosomal rearrangement with a detailed explanation of its known clinical associations, emphasizing the variability in expressivity and the need for correlation with other clinical findings and potential further genetic testing. Option D. Report the chromosomal rearrangement as definitively indicative of a severe developmental disorder, recommending immediate termination of the pregnancy. The correct answer is C. Report the chromosomal rearrangement with a detailed explanation of its known clinical associations, emphasizing the variability in expressivity and the need for correlation with other clinical findings and potential further genetic testing. Explanation. Scenario analysis. This scenario presents a common challenge in cytogenetics where a specific chromosomal abnormality detected in a prenatal sample has variable clinical significance. The challenge lies in accurately interpreting the finding in the context of the patient's specific clinical presentation and family history, while adhering to established diagnostic guidelines and communicating complex genetic information effectively. The CLSp, CG, must balance the technical accuracy of the cytogenetic result with its clinical implications, ensuring patient care is guided by evidence-based interpretation and appropriate counseling. Correct approach analysis. The correct approach involves a comprehensive review of the cytogenetic finding in conjunction with all available clinical information. This includes correlating the specific chromosomal abnormality with known phenotypes, considering its prevalence in different clinical conditions, and assessing its potential impact on fetal development and long-term health. This aligns with the CLSp, CGS responsibility to provide accurate and clinically relevant diagnostic information, as mandated by professional standards and regulatory bodies that emphasize the integration of laboratory findings with patient care. The CLSp, CG, must also consider the implications for genetic counseling and further diagnostic testing, ensuring a holistic approach to patient management. Incorrect approaches analysis. One incorrect approach would be to solely focus on the presence of the chromosomal abnormality without considering its clinical context. This fails to acknowledge that many chromosomal variations are benign or have variable expressivity, and a definitive diagnosis cannot be made based on the cytogenetic result alone. This approach risks overdiagnosis or underdiagnosis, leading to inappropriate patient management and potentially causing undue anxiety or false reassurance. It violates the principle of providing clinically actionable information and may contravene guidelines that require correlation with clinical findings. Another incorrect approach would be to dismiss the finding as insignificant without a thorough review of its known clinical associations. This could lead to misdiagnoses of serious genetic conditions, with severe consequences for the patient and family. It demonstrates a lack of due diligence and a failure to apply comprehensive knowledge of cytogenetic abnormalities and their clinical relevance, which is a core competency for a CLSp, CG. This approach neglects the potential for a subtle but significant abnormality to impact fetal health. A third incorrect approach would be to provide a definitive prognosis based solely on the cytogenetic finding, without considering other contributing factors or the inherent variability of genetic conditions. This oversimplifies complex genetic scenarios and can lead to inaccurate predictions about the child's future health and development. It bypasses the need for multidisciplinary assessment and genetic counseling, which are crucial for informed decision-making by the patient and family. Professional reasoning. When faced with a cytogenetic finding with variable clinical significance, a CLSp, CG should adopt a systematic approach. This involves 1. Thoroughly reviewing the cytogenetic data for accuracy and completeness. 2. Consulting relevant databases and literature to understand the known clinical associations, prevalence, and penetrance of the identified abnormality. 3. Collaborating with clinical geneticists and other healthcare providers to integrate the cytogenetic findings with the patient's clinical presentation, family history, and other diagnostic results. 4. Communicating the findings and their potential implications clearly and comprehensively to the referring physician, and as appropriate, to genetic counselors for patient counseling. This ensures that diagnostic information is used effectively to guide patient care and support informed decision-making. Question 4. To address the challenge of ensuring accurate and reliable fluorescence in situ hybridization, FISH, results for a patient with a suspected chromosomal abnormality, what is the most appropriate course of action for a clinical laboratory specialist in cytogenetics, CLSp, CG, operating under U.S. regulatory frameworks? Option A. Proceed with the FISH assay using a probe that a colleague has successfully used in a different laboratory, bypassing the need for internal validation and protocol adherence. Option B. Utilize a novel FISH probe recently published in a peer-reviewed journal that appears to be a good fit for the suspected abnormality, even if it has not yet undergone formal laboratory validation. Option C. Perform the FISH assay with a probe that is readily available in the lab, prioritizing speed of turnaround time over strict adherence to the validated protocol and quality control measures. Option D. Select the FISH probe based on the clinical indication, ensuring it is validated and part of the laboratory's approved test menu. Then meticulously follow the validated protocol with rigorous quality control and accurate reporting. The correct answer is D. Select the FISH probe based on the clinical indication, ensuring it is validated and part of the laboratory's approved test menu. Then meticulously follow the validated protocol with rigorous quality control and accurate reporting. Explanation. Scenario analysis. This scenario presents a professional challenge for a clinical laboratory specialist in cytogenetics, CLSp, CG. Due to the critical nature of accurate FISH probe selection and application in diagnosing genetic disorders, the challenge lies in balancing the need for timely results with the absolute requirement for regulatory compliance and patient safety. Misinterpreting or misapplying FISH probes can lead to incorrect diagnoses, impacting patient management, and potentially leading to inappropriate treatment or lack of necessary intervention. The CLSp, CG, must navigate the complexities of probe validation, quality control, and adherence to established protocols, all while ensuring the integrity of the diagnostic process. Correct approach analysis. The correct approach involves a systematic review of the patient's clinical indication, followed by meticulous selection of the appropriate, validated FISH probe based on established guidelines and the laboratory's approved test menu. This is followed by rigorous adherence to the validated protocol, including proper specimen handling, probe hybridization, washing, and signal detection. Crucially, it necessitates thorough quality control checks before and during the assay, and accurate interpretation and reporting of results, all within the framework of CLIA, Clinical Laboratory Improvement Amendments, regulations, which govern laboratory testing in the United States. CLIA mandates that laboratories establish and maintain quality systems to ensure the accuracy and reliability of test results. This includes requirements for personnel qualifications, quality control, proficiency testing, and documentation, all of which are directly applicable to the proper performance of FISH assays. Incorrect approaches analysis. One incorrect approach would be to proceed with a FISH assay using a probe that has not been formally validated by the laboratory for the specific clinical indication, or one that is not part of the approved test menu. This violates CLIA regulations regarding test validation and quality assurance, as unvalidated tests may not have established performance characteristics, leading to unreliable results. Another incorrect approach is to deviate from the established, validated protocol without proper documentation and justification. Such deviations can compromise assay performance and introduce errors, contravening CLIA requirement for standardized procedures and quality control. Furthermore, failing to perform or document adequate quality control measures before or during the FISH assay is a direct violation of CLIA, which mandates robust QC to ensure test accuracy. Finally, using a probe based solely on anecdotal evidence or a colleague's suggestion without consulting validated literature or laboratory protocols is a significant ethical and regulatory failure, as it bypasses the scientific rigor and oversight required for patient care. Professional reasoning. Professionals should employ a decision-making process that prioritizes patient safety and regulatory compliance. This involves a thorough understanding of the clinical context, a commitment to using only validated methodologies and reagents, and strict adherence to established protocols and quality control procedures. When faced with uncertainty, consulting with supervisors, reviewing relevant literature, and adhering to laboratory-specific standard operating procedures, SOP, are essential steps. The CLIA framework provides the overarching regulatory structure that mandates these practices, ensuring that all laboratory testing, including complex molecular techniques like FISH, is performed to the highest standards of accuracy and reliability. Question 5. The monitoring system demonstrates a karyotype with an extra copy of chromosome 21 in all analyzed metaphase cells. Based on the International System for Human Cytogenomic Nomenclature, ISCN, how should this finding be classified and reported to ensure accurate clinical interpretation and adherence to regulatory standards for cytogenetic diagnostics? Option A balanced translocation involving chromosome 21 and another chromosome. Option B, a mosaicism for chromosome 21 indicating variation in cell lines. Option C, a structural rearrangement involving chromosome 21 described by its breakpoints. Option D, a numerical aneuploidy, specifically trisomy 21, reported as 47 plus 21. Correct answer is D. A numerical aneuploidy, specifically trisomy 21, reported as 47 plus 21. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of accurate cytogenetic analysis in patient diagnosis and management. Misinterpreting or misclassifying a chromosomal abnormality can lead to incorrect treatment plans, genetic counseling, and significant patient anxiety. The CLSp, CG, must exercise meticulous attention to detail and a thorough understanding of established classification systems to ensure diagnostic integrity. The challenge lies in distinguishing between subtle variations and clinically significant abnormalities, and in applying the correct nomenclature and classification. Correct approach analysis. The correct approach involves a systematic evaluation of the observed chromosomal findings against established international classification systems, such as the International System for Human Cytogenomic Nomenclature, ISCN. This ensures consistency, reproducibility, and clear communication of results within the scientific and clinical communities. Adherence to ISCN guidelines is paramount for accurate reporting of chromosomal abnormalities, including their type, e.g., numerical, structural, and specific classification, e.g., aneuploidy, translocation, deletion. This aligns with regulatory requirements for laboratory quality and patient safety, ensuring that all diagnostic reports are standardized and interpretable by other healthcare professionals. Incorrect approaches analysis. One incorrect approach would be to rely solely on visual pattern recognition without consulting or applying the official nomenclature and classification guidelines. This risks subjective interpretation and misclassification, failing to meet the standards of accuracy and consistency required by regulatory bodies overseeing clinical laboratories. Another incorrect approach is to report a novel or unclassified abnormality without proper validation and adherence to the established procedures for describing new findings within the ISCN framework. This bypasses the rigorous peer review and standardization processes essential for reliable diagnostic reporting. A third incorrect approach is to oversimplify the description of a complex abnormality, omitting critical details about its type and location, which would hinder accurate clinical correlation and genetic counseling, thereby violating professional standards of care and potentially regulatory mandates for comprehensive reporting. Professional reasoning. Professionals should approach such situations by first meticulously documenting all observed chromosomal features. Subsequently, they must consult the most current version of the ISKIN manual to accurately classify the abnormality based on its type and specific characteristics. If the abnormality is novel or complex, the professional should follow established protocols for describing and reporting such findings, which may involve consultation with senior cytogeneticists or geneticists. This systematic, evidence-based approach, grounded in established nomenclature and classification, ensures diagnostic accuracy, facilitates interdisciplinary communication, and upholds regulatory and ethical obligations to the patient. Question 6. The assessment process reveals that a junior technologist has reported a karyotype with a suspected subtle deletion on chromosome 5, but only analyzed 10 metaphase spreads, and the banding resolution was suboptimal. The technologist did not perform any confirmatory testing. What is the most appropriate course of action for the supervising specialist? Option A. Report the suspected deletion based on the initial findings, as the clinical indication warrants investigation, and address the analytical limitations in the final report. Option B. Instruct the technologist to discard the current slides and prepare new ones, focusing on achieving higher banding resolution without reanalyzing the same number of metaphases. Option C. Accept the reported karyotype as preliminary and advise the technologist to proceed with reporting the finding to the clinician. Noting the limitations of the analysis, Option D. Immediately request the technologist to reanalyze a minimum of 20 metaphase spreads with improved banding techniques, and, if the abnormality persists, proceed with FISH analysis to confirm the suspected deletion. The correct answer is D. Immediately request the technologist to reanalyze a minimum of 20 metaphase spreads with improved banding techniques, and if the abnormality persists, proceed with FISH analysis to confirm the suspected deletion. Explanation. The assessment process reveals a common challenge in cytogenetics, ensuring the accuracy and reliability of karyotype analysis, particularly when dealing with subtle chromosomal abnormalities or mosaicism. This scenario demands meticulous attention to detail and adherence to established protocols, as misinterpretation can have significant clinical implications for patients. The professional challenge lies in balancing the need for timely reporting with the imperative of diagnostic certainty, especially when faced with ambiguous findings. The correct approach represents best professional practice because it prioritizes a systematic and thorough review of the karyotype, incorporating multiple levels of analysis and verification. This includes ensuring adequate cell capture, proper chromosome banding, and a comprehensive examination of all metaphases. The use of banding techniques, such as G-banding, is a fundamental requirement for identifying structural rearrangements and numerical aneuploidies, as mandated by standard laboratory practices and guidelines for cytogenetic analysis. Furthermore, the decision to perform FISH or CMA for confirmation of suspected abnormalities directly aligns with best practices for resolving complex or equivocal karyotype findings, ensuring diagnostic accuracy and patient safety. This methodical approach minimizes the risk of false positives or negatives, upholding the integrity of the diagnostic process. An incorrect approach that involves solely relying on a limited number of metaphases for analysis is professionally unacceptable. This fails to account for potential mosaicism, where an abnormality may not be present in every cell. Regulatory guidelines for cytogenetic analysis typically require a minimum number of metaphases to be analyzed to ensure adequate detection of mosaicism, thereby preventing misdiagnosis. Another incorrect approach, such as reporting a suspected abnormality without further confirmatory testing when the banding resolution is insufficient, poses a significant ethical and regulatory failure. This bypasses essential validation steps, potentially leading to an incorrect diagnosis and inappropriate clinical management. It violates the principle of providing accurate and reliable diagnostic information, which is a cornerstone of professional responsibility in medical laboratory science. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's clinical indication. This is followed by a systematic review of the prepared slides, ensuring optimal quality of metaphase spreads and banding. If initial analysis reveals potential abnormalities, the professional must assess the clarity and resolution of the banding. If ambiguity exists or if mosaicism is suspected, the next step is to consult established laboratory protocols for confirmatory testing, such as increasing the number of metaphases analyzed or employing molecular cytogenetic techniques like FISH or chromosomal microarray, CMA. This iterative process of analysis, assessment, and confirmation, guided by regulatory requirements and best practices, ensures the highest standard of patient care. Question 7. The risk matrix shows a high probability of a serious heritable condition being identified in a patient's cytogenetic analysis. The patient, after being informed of the potential implications for their family, explicitly refuses to consent to any disclosure of this information to relatives, citing personal and familial reasons. As a clinical laboratory specialist in cytogenetics, CLSp, CG, operating under U.S. federal regulations, what is the most appropriate course of action regarding the patient's genetic findings and their potential impact on family members? Option A. Report the findings to a public health agency, as heritable conditions often have broader public health implications. Option B. Disclose the findings to the patient's primary care physician, who can then decide whether to recounsel the patient or pursue disclosure. Option C. Inform the patient's closest living relative directly about the genetic findings to prevent potential harm to the family. Option D. Respect the patient's decision and maintain strict confidentiality of the findings, while documenting the discussion and the patient's refusal to consent for disclosure. The correct answer is D. Respect the patient's decision and maintain strict confidentiality of the findings, while documenting the discussion and the patient's refusal to consent for disclosure. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a CLSp, CG, must balance patient confidentiality with the potential for harm to others. The discovery of a genetic predisposition to a serious, heritable condition in a patient who has not consented to disclosure of this information creates a conflict between the CLSp, CG's duty to the patient and a broader societal concern. The professional challenge lies in navigating the legal and ethical boundaries of reporting such findings when they have implications beyond the individual patient. The CLSp, CG, must consider the scope of their professional responsibilities as defined by regulatory frameworks and professional guidelines, particularly concerning genetic information and its potential impact on family members. Correct approach analysis. The correct approach involves adhering strictly to the established regulatory framework and professional guidelines governing patient confidentiality and the reporting of genetic information. In the U.S., the Health Insurance Portability and Accountability Act, HIPAA, is paramount, establishing stringent rules for the privacy and security of protected health information. 5. Cytogeneticists are bound by these regulations, which generally prohibit the disclosure of PHI without patient authorization, except in very specific, legally defined circumstances, e.g., imminent threat of serious harm, as mandated by law. Therefore, the CLSp, CG must prioritize obtaining patient consent for any disclosure to family members. This aligns with the ethical principle of patient autonomy and the legal requirement to protect PHI. The CLSp, CG, should engage in a thorough discussion with the patient about the implications of their findings for their family and explore options for voluntary disclosure or genetic counseling. Incorrect approaches analysis. One incorrect approach would be to disclose the genetic findings to the patient's family members without the patient's explicit consent. This directly violates HIPAA regulations, which define genetic information as PHI and mandate patient authorization for its release. Ethically, this breaches patient confidentiality and autonomy, potentially damaging the patient-physician relationship and trust in the laboratory. Another incorrect approach would be to ignore the findings and take no action, even if the patient refuses consent for disclosure. While patient consent is paramount, the CLSp, CG, has a professional responsibility to ensure the patient understands the implications of their results. Simply disregarding the information without further discussion or offering resources like genetic counseling could be seen as a failure to provide adequate patient care and education, especially given the serious nature of the condition. However, this is less of a direct regulatory violation than unauthorized disclosure. A third incorrect approach would be to unilaterally decide that the potential harm to family members outweighs patient confidentiality and proceed with disclosure. This bypasses the legal and ethical framework that governs such decisions. Regulatory bodies and professional organizations provide clear guidelines on when exceptions to confidentiality can be made, and these typically involve specific legal mandates or imminent, severe threats that are clearly defined and documented. A CLSp, CG, acting solely on their own judgment without following established protocols for risk assessment and legal consultation would be acting outside their scope of practice and regulatory compliance. Professional reasoning. Professionals in this field must employ a decision-making process that prioritizes legal compliance and ethical conduct. This involves 1. Understanding the scope of cytogenetics, recognizing that the laboratory's role is to generate accurate diagnostic information, and the interpretation and communication of that information, especially concerning heritable conditions, involves complex ethical and legal considerations. 2. Adhering to regulatory frameworks, strictly following laws like HIPAA in the U.S., which dictate the handling of patient information. 3. Upholding ethical principles, prioritizing patient autonomy, confidentiality, and beneficence. 4. Consulting with appropriate parties. When faced with complex ethical dilemmas, consulting with the ordering physician, the institution's ethics committee, or legal counsel is crucial. 5. Patient-centered communication. Engaging in open and empathetic communication with the patient to ensure they understand their results and the implications for their family, and to facilitate informed decision-making regarding disclosure. Question 8. Consider a scenario where a CLSp, CG, identifies a chromosomal abnormality in a patient's sample that, based on standard databases, is considered of uncertain significance, thus. However, the patient's clinical presentation includes a constellation of symptoms that are highly suggestive of a specific genetic syndrome, typically associated with a different, well-established chromosomal aberration. What is the most appropriate course of action for the CLSp, CG, to ensure the accurate integration of cytogenetic data with clinical information? Option A. Reanalyze the cytogenetic data to force a match with the suspected syndrome, even if the identified aberration does not perfectly align with the typical findings for that syndrome. Option B. Report the VUS finding as identified and await further clinical correlation from the ordering physician, without proactively seeking additional clinical context or suggesting further investigation based on the patient's symptoms. Option C. Report the VUS finding as identified and proceed with treatment recommendations based solely on the patient's clinical symptoms, assuming the cytogenetic finding is unrelated. Option D. Report the VUS finding and include a detailed commentary in the report highlighting the patient's suggestive clinical symptoms and recommending further clinical evaluation and genetic counseling to explore potential correlations and alternative diagnostic pathways. The correct answer is B. Report the VUS finding as identified and await further clinical correlation from the ordering physician, without proactively seeking additional clinical context or suggesting further investigation based on the patient's symptoms. Explanation. This scenario presents a professional challenge due to the critical need to accurately interpret cytogenetic findings within the context of a patient's specific clinical presentation. The integration of these two distinct data streams is paramount for accurate diagnosis, prognosis, and treatment planning. Failure to properly integrate this information can lead to misdiagnosis, inappropriate therapeutic interventions, and ultimately, suboptimal patient outcomes. The CLSp, CG professional is ethically and regulatorily bound to ensure that all reported findings are clinically relevant and actionable. The correct approach involves a systematic and collaborative process of data synthesis. This means actively seeking out and understanding the patient's clinical history, symptoms, and other relevant laboratory or imaging findings. By correlating these with the cytogenetic results, the CLSp, CG can identify potential discrepancies, confirm suspected diagnoses, or uncover new insights. This aligns with the regulatory framework's emphasis on the accuracy and clinical utility of laboratory testing, ensuring that the cytogenetic report contributes meaningfully to patient care. This collaborative approach also reflects best professional practice, fostering communication between laboratory professionals and clinicians. An incorrect approach would be to report cytogenetic findings in isolation, without any attempt to correlate them with the patient's clinical information. This fails to meet the regulatory expectation that laboratory results are provided in a manner that facilitates clinical interpretation. Ethically, it represents a dereliction of duty to the patient by not providing the most comprehensive and useful information possible. Another incorrect approach would be to make definitive clinical interpretations based solely on cytogenetic data without consulting with or considering the full clinical picture, potentially leading to over or undertreatment. This oversteps the scope of practice for a CLSp, CG, and can have serious patient safety implications. A further incorrect approach would be to dismiss or ignore clinical information that appears to contradict the cytogenetic findings without further investigation or consultation, thereby potentially missing crucial diagnostic clues. The professional decision-making process in such situations should involve a commitment to thoroughness and collaboration. When presented with cytogenetic data, the CLSp, CG, must proactively inquire about and review the relevant clinical context. If there are ambiguities or apparent conflicts between the cytogenetic and clinical data, the professional should initiate communication with the ordering physician or relevant clinical team to clarify the information and ensure a shared understanding. This iterative process of data integration and communication is essential for providing high-quality diagnostic services. Question 9. The investigation demonstrates the use of multiplex PCR to screen for microdeletions within a specific chromosomal region suspected in a patient with developmental delay. The PCR assay amplifies several known loci within this region, with the expectation that the absence of a specific amplicon indicates a deletion. The initial results show the expected amplification for most loci. One locus consistently fails to amplify across multiple replicates, while a control locus amplifies robustly. Which of the following interpretations and subsequent actions best reflects best professional practice and regulatory compliance for a CLSp CG? Option A. Interpret the absence of the amplicon as a technical artifact and proceed with reporting the other amplified loci as normal, without mentioning the unamplified locus. Option B. Assume the PCR assay is faulty for that specific locus due to primer degradation and discard the results without further investigation or reporting. Option C. Report the absence of the specific amplicon as a potential microdeletion. Recommend confirmatory testing using an alternative molecular or cytogenetic method, and ensure all experimental parameters and controls are meticulously documented. Option D. Conclude that the absence of the specific amplicon definitively indicates a microdeletion at that locus, and proceed with reporting this finding to the referring physician. The correct answer is D. Conclude that the absence of the specific amplicon definitively indicates a microdeletion at that locus, and proceed with reporting this finding to the referring physician. Explanation. Scenario analysis. This scenario presents a common challenge in cytogenetics where a molecular technique, PCR, is used to investigate a potential chromosomal abnormality. The challenge lies in interpreting the PCR results in the context of established cytogenetic principles and regulatory expectations for diagnostic accuracy and reporting. The CLSp, CG, must integrate molecular findings with traditional cytogenetic knowledge, ensuring that the interpretation is robust, reproducible, and aligns with the quality standards mandated by regulatory bodies governing clinical laboratory practice. The pressure to provide a timely and accurate diagnosis for a patient with a suspected genetic disorder adds to the complexity. Correct approach analysis. The correct approach involves a comprehensive interpretation of the PCR results, considering potential amplification biases, primer design, and the expected amplicon sizes in relation to the suspected chromosomal rearrangement. This approach aligns with best professional practice by ensuring that the molecular data is validated and interpreted within the broader cytogenetic context. Regulatory frameworks for clinical laboratories, such as those overseen by the College of American Pathologists (CAP), or the Centers for Medicare and Medicaid Services (CMS) in the U.S., emphasize the need for validated methods, accurate interpretation, and clear reporting of findings. A thorough analysis of PCR data, including controls and expected outcomes, is crucial for meeting these standards and ensuring patient safety. This approach prioritizes diagnostic integrity and adherence to quality assurance protocols. Incorrect approaches analysis. One incorrect approach would be to solely rely on the presence or absence of a single PCR product, without considering potential confounding factors or the need for confirmatory testing. This could lead to misinterpretation, such as a false positive or false negative result, which directly violates regulatory requirements for accurate diagnostic testing. Such an approach fails to meet the standards of analytical validation and quality control expected in a CLIA-certified laboratory. Another incorrect approach would be to report the PCR findings without adequate correlation to the clinical presentation or other cytogenetic data, if available. This would be a failure in comprehensive diagnostic reporting, potentially misleading the clinician and impacting patient management. Regulatory guidelines mandate that laboratory reports are clear, concise, and provide sufficient information for clinical interpretation. A third incorrect approach would be to proceed with a definitive diagnosis based on preliminary or unconfirmed PCR results, especially if the amplification is weak or inconsistent. This bypasses essential quality control steps and the requirement for method validation, which are critical for maintaining laboratory accreditation and ensuring the reliability of diagnostic information. This directly contravenes the principles of good laboratory practice and regulatory compliance. Professional reasoning. When faced with molecular data in a cytogenetic context, a CLSp, CG should adopt a systematic approach. First, critically evaluate the PCR experimental design, including primer specificity, annealing temperatures, and the inclusion of appropriate positive and negative controls. Second, analyze the amplification products, considering expected sizes and any unexpected bands. Third, correlate these findings with known cytogenetic alterations and the patient's clinical information. Fourth, consult with senior technologists or laboratory directors if interpretation is uncertain. Finally, ensure that all findings are documented thoroughly and reported in accordance with laboratory protocols and regulatory requirements, prioritizing accuracy, reproducibility, and patient welfare. Question 10. Upon reviewing a FISH analysis that identifies a specific chromosomal rearrangement in a patient sample, and considering that karyotyping is the established gold standard for chromosomal analysis, which of the following represents the most appropriate next step for ensuring diagnostic accuracy and regulatory compliance? Option A. Proceed with reporting the FISH result without further cytogenetic investigation, assuming the FISH probe is sufficiently validated for standalone diagnostic use. Option B. Dismiss the FISH finding if it shows any minor deviation from a previously performed but potentially older karyotype. Option C. Immediately report the FISH finding as definitive, as novel FISH probes are designed for high specificity and sensitivity. Option D. Corroborate the FISH finding with a standard G-banded karyotype analysis to confirm the presence and precise nature of the chromosomal rearrangement. The correct answer is D. Corroborate the FISH finding with a standard G-banded karyotype analysis to confirm the presence and precise nature of the chromosomal rearrangement. Explanation. The scenario presents a common challenge in cytogenetics, interpreting results from different methodologies and understanding their implications for patient care and laboratory quality assurance. The professional challenge lies in accurately correlating findings from a novel FISH probe with established cytogenetic techniques like karyotyping, ensuring that the interpretation is both clinically relevant and compliant with regulatory standards for diagnostic testing. Careful judgment is required to avoid misinterpretation, which could lead to incorrect diagnoses or treatment decisions. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of cytogenetic abnormalities by integrating data from multiple validated techniques. This aligns with regulatory requirements for proficiency testing, quality control, and accurate reporting of diagnostic results. Specifically, it emphasizes the importance of confirming findings with a gold standard or complementary method, which is a cornerstone of robust laboratory practice and ensures the reliability of the diagnostic report. This approach upholds the ethical obligation to provide accurate and dependable patient information. An incorrect approach that relies solely on the novel FISH probe without confirmatory karyotyping fails to meet the standards for diagnostic validation. This could be a regulatory failure under frameworks that mandate the use of validated methods and the confirmation of significant findings. Ethically, it represents a failure to exercise due diligence, potentially leading to an inaccurate diagnosis. Another incorrect approach that dismisses the FISH result due to a minor discrepancy with a prior karyotype without further investigation also poses a risk. This could be a failure to adequately investigate discordant results, which is often a requirement for laboratory accreditation, and a breach of professional responsibility to thoroughly evaluate all available data. A third incorrect approach that prioritizes speed over accuracy by reporting preliminary fish findings without full correlation with karyotype data is a direct violation of quality assurance principles and regulatory expectations for timely yet accurate reporting. Professional decision-making in such situations should involve a systematic process. First, thoroughly review all available data, including patient history, previous testing, and current results. Second, consult established protocols and literature regarding the specific genetic abnormality and the methodologies used. Third, if discrepancies exist, initiate confirmatory testing or further investigation as per laboratory policy and regulatory guidelines. Finally, ensure all findings are accurately documented and reported in a clear, concise manner, reflecting the integrated interpretation of all relevant data. Question 11. Governance review demonstrates that the laboratory's prenatal cytogenetics diagnostic turnaround time is exceeding established benchmarks, impacting patient counseling timelines. To address this, the laboratory director is considering several process optimization strategies. Which of the following strategies best aligns with the regulatory framework for prenatal diagnosis, ensuring both efficiency and diagnostic integrity? Option A. Streamlining the karyotyping workflow by reducing the number of metaphase spreads analyzed per sample and shortening the time allocated for microscopic review, while maintaining existing quality control checks. Option B. Conducting a comprehensive validation study of a novel, automated fish probe application for common chromosomal abnormalities, integrating it into the existing workflow after demonstrating its concordance with current diagnostic standards and obtaining necessary internal and external approvals. Option C. Expediting sample accessioning and preliminary slide preparation by reassigning technical staff from quality assurance duties to direct sample processing. Option D. Implementing a new, unvalidated next-generation sequencing platform for rapid aneuploidy screening without prior comparative validation against established karyotyping methods and without seeking necessary regulatory amendments. Correct answer is D. Implementing a new, unvalidated next-generation sequencing platform for rapid aneuploidy screening without prior comparative validation against established karyotyping methods and without seeking necessary regulatory amendments. Explanation. Scenario analysis. This scenario presents a professional challenge in balancing the rapid advancement of cytogenetic technologies with the established regulatory requirements for prenatal diagnosis. The pressure to integrate new methodologies while ensuring patient safety, diagnostic accuracy, and adherence to established protocols necessitates careful consideration of process optimization. The core challenge lies in determining how to improve efficiency and turnaround time without compromising the integrity and reliability of diagnostic results, which have significant implications for expectant parents. Correct approach analysis. The optimal approach involves a systematic evaluation of existing workflows, identifying bottlenecks, and implementing evidence-based improvements that align with current regulatory standards for prenatal cytogenetic testing. This includes validating new technologies against established benchmarks, ensuring robust quality control measures are in place, and providing comprehensive training for laboratory personnel. This approach represents best professional practice because it prioritizes patient care and diagnostic accuracy by ensuring that any process optimization is grounded in scientific validity and regulatory compliance. It adheres to the principles of good laboratory practice and the specific requirements for prenatal diagnostic services, ensuring that the laboratory operates within the established legal and ethical framework. Incorrect approach is analysis. One incorrect approach would be to prematurely adopt a new, unvalidated technology solely based on its perceived speed advantage without rigorous validation and regulatory approval. This poses a significant regulatory failure by potentially introducing unproven diagnostic methods into patient care, violating the principle of providing accurate and reliable results. Ethically, it fails to uphold the duty of care to patients by exposing them to potentially inaccurate diagnoses. Another incorrect approach would be to bypass established quality assurance protocols in an effort to expedite sample processing. This represents a direct violation of regulatory requirements for laboratory testing, which mandates stringent quality control to ensure the accuracy and reliability of results. Such a failure could lead to misdiagnosis, with profound consequences for families. A third incorrect approach would be to implement process changes without adequate staff training or competency assessment. This is a regulatory failure as it compromises the ability of personnel to perform tests accurately and consistently, potentially leading to errors. Ethically, it fails to ensure that the laboratory is staffed by competent individuals capable of providing safe and effective diagnostic services. Professional reasoning. Professionals should approach process optimization in prenatal cytogenetics by first understanding the current regulatory landscape and the specific requirements for diagnostic accuracy and patient safety. This involves a thorough risk assessment of any proposed changes, focusing on how they impact the reliability and validity of diagnostic results. A phased implementation, coupled with robust validation and ongoing quality monitoring, is crucial. Decision-making should be guided by a commitment to evidence-based practice, regulatory compliance, and ethical considerations, ensuring that all changes ultimately benefit patient outcomes. Question 12. Examination of the data shows that an automated karyotyping system has been in use for 2 years without any reported issues. The laboratory director is considering reducing the frequency of independent performance verification checks to quarterly, citing the system's reliability and the manufacturer's recommendation for annual recalibration. What is the most appropriate regulatory compliant course of action? Option A. Rely solely on the manufacturer's stated performance specifications and recalibration schedule, assuming the system's accuracy is guaranteed by its advanced technology. Option B. Cease independent performance verification checks until a significant discrepancy in results is observed, as the system has proven reliable. Option C. Reduce independent performance verification checks to annually, aligning with the manufacturer's recalibration schedule. To optimize laboratory resources, Option D. Continue with quarterly independent performance verification checks and ensure recalibration occurs annually as per manufacturer recommendations, while maintaining detailed records of all checks and any adjustments made. The correct answer is D. Continue with quarterly independent performance verification checks and ensure recalibration occurs annually as per manufacturer recommendations, while maintaining detailed records of all checks and any adjustments made. Explanation. The scenario presents a common challenge in cytogenetics, ensuring the accuracy and reliability of automated systems used for karyotyping. The professional challenge lies in balancing the efficiency gains of automation with the absolute requirement for diagnostic accuracy, as mandated by regulatory bodies governing clinical laboratory practice. This requires a deep understanding of the system's limitations and the validation processes necessary to maintain compliance. The correct approach represents best professional practice because it directly addresses the regulatory requirement for ongoing quality assurance and system validation. Specifically, it aligns with the principles of CLIA, Clinical Laboratory Improvement Amendments, in the United States, which mandates that laboratories establish and maintain quality control procedures to ensure the accuracy and reliability of test results. Regular recalibration and performance verification of automated karyotyping systems are essential components of this quality assurance program. This proactive approach minimizes the risk of reporting erroneous results, which could have significant clinical consequences for patients. An incorrect approach that relies solely on manufacturer recommendations without independent verification fails to meet the laboratory's responsibility for ensuring the accuracy of its testing. Regulatory frameworks, such as CLIA, require laboratories to validate the performance of all laboratory procedures, including those performed on automated equipment. Relying solely on manufacturer specifications does not constitute independent validation and may not account for the specific environmental conditions or usage patterns within a particular laboratory, potentially leading to performance drift. Another incorrect approach, which involves only addressing issues when a significant discrepancy is noted, is reactive rather than proactive. This approach increases the risk of reporting inaccurate results for an extended period before detection. Regulatory guidelines emphasize a proactive approach to quality control, requiring routine monitoring and verification to prevent errors from occurring or to detect them promptly. Waiting for a significant discrepancy to arise indicates a failure in the established quality control system. A further incorrect approach, which involves assuming the automated system is always accurate due to its advanced technology, demonstrates a critical misunderstanding of the nature of automated systems. While advanced, these systems are not infallible and can be affected by various factors, including software glitches, hardware malfunctions, or environmental changes. Regulatory compliance demands a critical and evidence-based approach to system performance, not blind faith in technology. A professional decision-making process in such situations should involve a thorough understanding of the relevant regulatory requirements, e.g., CLIA in the U.S., the manufacturer's guidelines, and the laboratory's own established quality assurance policies. This includes implementing a robust validation and verification protocol for all automated systems, conducting regular quality control checks, and maintaining detailed records of system performance. When any deviation from expected performance is observed, a systematic investigation should be initiated, followed by appropriate corrective actions and documentation. Question 13. Performance analysis shows that whole genome sequencing, WGS, has become increasingly accessible for diagnosing complex genetic conditions. A CLSp, CG, has completed WGS on a patient with a rare, undiagnosed neurological disorder. The primary care physician who ordered the test has limited expertise in genetics and has requested a summary of the findings and their clinical implications. Which of the following approaches best reflects the CLSp, CGS professional responsibility in this situation? Option A. Directly contact the patient to explain the most concerning genetic findings and suggest potential treatment avenues, bypassing the primary care physician. Option B. Focus the report solely on common genetic predispositions that are generally relevant to neurological health, omitting any novel or rare variants that might be specific to the patient's condition. Option C. Provide a detailed report to the primary care physician that prioritizes variants with established clinical significance and strong evidence linking them to the patient's phenotype, clearly explaining the potential impact and any actionable recommendations, while also noting the limitations of the current interpretation. Option D. Submit a comprehensive list of all identified variants, including those with unknown significance and those unrelated to the patient's presenting symptoms, to the primary care physician for their independent review. The correct answer is C. Provide a detailed report to the primary care physician that prioritizes variants with established clinical significance and strong evidence linking them to the patient's phenotype, clearly explaining the potential impact and any actionable recommendations, while also noting the limitations of the current interpretation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinical laboratory specialist in cytogenetics, CLSp, CG, to interpret and communicate complex genomic data from whole genome sequencing, WGS, to a non-expert stakeholder, the patient's primary care physician. The challenge lies in bridging the gap between highly technical genetic information and its clinical relevance, ensuring accurate understanding and appropriate clinical action, without overstepping professional boundaries or misinterpreting the data's limitations. The CLSp, CG, must consider the implications of incidental findings, the evolving nature of genomic interpretation, and the need for clear, actionable recommendations. Correct approach analysis. The correct approach involves a comprehensive review of the WGS data, focusing on variants with established clinical significance or those that are highly likely to have clinical impact based on current knowledge and guidelines. This includes correlating findings with the patient's phenotype and medical history. The CLSp, CG, should then prepare a detailed report that clearly outlines the identified variants, their potential implications, and the evidence supporting these interpretations. Crucially, the CLSp, CG, must communicate these findings to the primary care physician in a manner that is understandable, highlighting the diagnostic yield, any actionable recommendations for further testing or management, and the limitations of the current interpretation. This approach aligns with the CLSp, CG's role in providing expert genetic analysis and supporting clinical decision-making, adhering to professional standards for reporting and communication of genetic test results. It emphasizes accuracy, clarity, and the collaborative nature of patient care, ensuring the physician receives the necessary information to manage the patient effectively. Incorrect approach is analysis, an approach that focuses solely on reporting all identified variants, regardless of their clinical significance or the patient's phenotype, is professionally unacceptable. This would overwhelm the primary care physician with irrelevant data, potentially leading to confusion, unnecessary anxiety, and misdirected clinical efforts. It fails to adhere to the principle of providing clinically actionable information and can be seen as a failure to exercise professional judgment in data interpretation. An approach that prioritizes reporting only common, well-established genetic predispositions without considering novel or rare findings that might explain the patient's specific presentation is also professionally flawed. This approach limits the diagnostic utility of WGS, which is often employed to investigate complex or undiagnosed conditions. It neglects the potential for WGS to uncover critical, albeit less common, genetic etiologies, thereby failing to fully serve the patient's diagnostic needs. An approach that involves directly advising the patient on treatment plans or making definitive diagnoses without the involvement of the ordering physician or a genetic counselor is a significant ethical and regulatory failure. The CLSp, CGS role is to provide laboratory-based interpretation and reporting, not to practice medicine or provide direct patient counseling. This oversteps professional boundaries and could lead to inappropriate medical interventions or patient distress. Professional reasoning. Professionals should adopt a systematic approach that begins with understanding the clinical question driving the WGS. This involves a thorough review of the patient's phenotype and medical history to contextualize the genomic data. The CLSp, CG, must then apply established guidelines and databases for variant interpretation, prioritizing those with clear clinical relevance. Communication should be tailored to the recipient's expertise, ensuring clarity and actionable insights. Collaboration with the ordering physician, and when necessary, genetic counselors is paramount for comprehensive patient care. This decision-making process emphasizes evidence-based interpretation, professional responsibility, and ethical conduct. Question 14. The performance metrics show a consistent delay in the transmission of cytogenetic reports to referring healthcare providers, exceeding the established turnaround time targets. As a clinical laboratory specialist in cytogenetics, CLSp, CG, what is the most appropriate initial step to address this issue, ensuring compliance with U.S. federal and state laboratory regulations? Option A. Conduct a thorough review of the laboratory's current result reporting protocols and systems to identify any potential breaches in CLIA or state-specific regulatory compliance that may be contributing to the delays. Option B. Immediately implement a new, faster reporting system without fully investigating the current system's functionality or compliance. Option C. Advise healthcare providers to directly contact the laboratory by phone for all results until the reporting issue is resolved, regardless of result criticality. Option D. Prioritize reporting only critical results and defer all non-critical reports until a complete system overhaul can be completed. Correct answer is B. Immediately implement a new, faster reporting system without fully investigating the current system's functionality or compliance. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in cytogenetics, balancing the need for timely and accurate communication of potentially sensitive results with the imperative to adhere to strict regulatory requirements and ethical considerations. The performance metrics highlight a potential gap in the established communication pathways, raising concerns about patient safety, provider understanding, and regulatory compliance. The professional challenge lies in identifying the root cause of the delay and implementing a solution that is both efficient and compliant, ensuring that all stakeholders receive information appropriately and securely. Correct approach analysis. The correct approach involves a systematic review of existing protocols for result communication, focusing on identifying bottlenecks or areas of noncompliance with the Clinical Laboratory Improvement Amendments, CLIA, and relevant state regulations. This includes verifying that all communication methods, e.g., secure electronic health record, AIR, interfaces, fax, phone calls for critical values, are functioning as intended, and that personnel are adequately trained on these procedures. The emphasis on confirming adherence to CLIA quality system requirements, which mandate accurate and timely reporting of test results, and state-specific regulations governing laboratory reporting, is paramount. This approach ensures that the laboratory maintains its commitment to providing reliable diagnostic information to healthcare providers in a manner that supports patient care and meets all legal and ethical obligations. Incorrect approach is analysis. One incorrect approach would be to bypass established secure communication channels for expediency, such as sending results via unsecured email or personal messaging applications. This directly violates CLIA regulations concerning the integrity and confidentiality of patient test results and the Health Insurance Portability and Accountability Act, HIPAA, privacy rules, exposing patient data to unauthorized access and potential breaches. Another incorrect approach would be to delay reporting results until a comprehensive internal audit is completed, even if some results are routine and do not pose an immediate clinical concern. This failure to report in a timely manner, as required by CLIA, can negatively impact patient management and treatment decisions, potentially leading to adverse patient outcomes and regulatory sanctions for the laboratory. Furthermore, assuming the issue lies solely with the receiving healthcare provider, without investigating the laboratory's internal processes first, is also an inadequate response. This overlooks the laboratory's responsibility to ensure its reporting mechanisms are robust and compliant, potentially masking internal deficiencies that need correction. Professional reasoning. Professionals in cytogenetics must adopt a proactive and compliant approach to result communication. When performance metrics indicate a deviation, the first step is to investigate internal processes for adherence to CLIA and state regulations. This involves reviewing standard operating procedures, SOP, for result reporting, ensuring all personnel are trained on secure communication methods, and verifying the functionality of reporting systems. If internal processes are found to be compliant, then communication with the healthcare provider to troubleshoot external issues is appropriate. The ultimate goal is to ensure that results are communicated accurately, confidentially, and in a timely manner, as mandated by regulatory bodies, thereby upholding patient safety and the integrity of the laboratory services. Question 15. Analysis of the optimal cell culture technique for obtaining high-quality, metaphase chromosomes from peripheral blood lymphocytes for diagnostic cytogenetic analysis, considering the need for robust cell growth and chromosomal integrity, requires careful consideration of media composition and incubation conditions. Which of the following approaches best aligns with established best practices and regulatory expectation for a clinical laboratory specialist in cytogenetics, CLSp-CG? Option A. Employ a basal nutrient broth without any supplements, incubated at room temperature to conserve resources. Option B. Use a commercially prepared cell culture medium that has passed its expiration date but has been stored at room temperature. Option C. Utilize a standard RPMI 1640 medium supplemented with 10-20% fetal bovine serum and a standard antibiotic antimycotic solution, incubated at 37 degrees C in a humidified incubator with 5% CO2. Option D. Culture cells in a medium containing only phytohemagglutinin, Pha, without any serum or antibiotics, incubated at ambient laboratory temperature. Correct answer is C. Utilize a standard RPMI 1640 medium supplemented with 10-20% fetal bovine serum and a standard antibiotic antimycotic solution, incubated at 37 degrees C in a humidified incubator with 5% CO2. Explanation. The scenario presents a common challenge in cytogenetics laboratories, optimizing cell culture conditions for diagnostic analysis. Ensuring successful and appropriate cell growth is paramount for obtaining metaphase chromosomes necessary for karyotyping and other cytogenetic techniques. The professional challenge lies in selecting the most suitable culture medium and conditions that not only promote cell proliferation, but also maintain chromosomal integrity and are compliant with laboratory accreditation standards. Careful judgment is required to balance growth efficiency with the preservation of genetic material. The correct approach represents best professional practice because it directly addresses the specific needs of different cell types for cytogenetic analysis, ensuring optimal yield and quality of metaphase chromosomes. This aligns with the principles of good laboratory practice and the requirements of regulatory bodies that mandate validated and appropriate methodologies for diagnostic testing. By selecting a medium supplemented with fetal bovine serum and antibiotics, and maintaining specific incubation parameters, the laboratory is adhering to established protocols that support robust cell growth and minimize contamination, thereby ensuring the reliability and accuracy of the diagnostic results. This proactive approach minimizes the risk of failed cultures, which can lead to delays in diagnosis and increased costs. An incorrect approach that relies solely on a generic, unsupplemented medium fails to account for the nutritional requirements of lymphocytes or other primary cells used in cytogenetic analysis. This can lead to poor cell growth, insufficient metaphase collection, and potentially compromised chromosomal morphology. Ethically, this could be considered a failure to provide adequate diagnostic services due to substandard methodology. From a regulatory perspective, it violates the principle of using validated and appropriate methods for testing, potentially leading to noncompliance with accreditation standards. Another incorrect approach that involves using a medium with expired supplements or improper storage conditions introduces a significant risk of microbial contamination and degradation of essential nutrients. This not only hinders cell growth, but can also introduce artifacts into the chromosomal preparations, leading to misinterpretation of results. This represents a direct violation of quality control measures mandated by regulatory frameworks, compromising patient safety and diagnostic accuracy. A further incorrect approach that neglects to monitor incubation parameters such as temperature and CO2 levels can lead to suboptimal pH and cell viability. Fluctuations in these conditions can stress the cells, affecting their ability to divide and produce metaphase chromosomes. This demonstrates a lack of diligence in maintaining a controlled laboratory environment, which is a fundamental requirement for reliable cytogenetic analysis and a breach of good laboratory practice. The professional decision-making process for similar situations should involve a thorough understanding of the specific cell type being cultured, its known growth requirements, and the established protocols for cytogenetic analysis. This includes consulting relevant literature, laboratory standard operating procedures, SOP, and regulatory guidelines. A systematic approach to media selection, preparation, and incubation, coupled with rigorous quality control measures, is essential. When faced with a choice of culture conditions, the professional should prioritize those that are validated, documented, and known to yield high-quality results, while adhering to all applicable regulatory and ethical standards. Question 16. Benchmark analysis indicates that a CLSp, CG, is reviewing CGH data for a patient with suspected developmental delay. The data reveals several copy number variations, CNV. Which of the following approaches best aligns with the regulatory framework and guidelines for the CLSp-CG in interpreting and reporting these findings? Option A. Report all identified CNVs directly from the raw data, assuming any variation is clinically relevant. Option B. Focus solely on reporting the number of CNVs detected, without further analysis of their location or potential clinical impact. Option C. Independently verify the identified CNVs against known databases and clinical literature, ensuring the CGH platform's performance is within acceptable quality control parameters, and consult with a clinical geneticist for interpretation of clinically significant findings. Option D. Accept the automated interpretation provided by the CGH software without further validation, as it is designed to identify CNVs. The correct answer is C. Independently verify the identified CNVs against known databases and clinical literature, ensuring the CGH platform's performance is within acceptable quality control parameters, and consult with a clinical geneticist for interpretation of clinically significant findings. Explanation. This scenario presents a professional challenge due to the critical need for accurate and compliant reporting of comparative genomic hybridization, CGH. Results within the specific regulatory framework governing the clinical laboratory specialist in cytogenetics CLSp, CG certification. The CLSp, CG role demands adherence to established guidelines for data interpretation, reporting, and quality assurance, particularly when dealing with complex genomic data like that generated by CGH. The professional must navigate the nuances of interpreting copy number variations, CNV, and their clinical significance, ensuring that the reported findings are both scientifically sound and meet all regulatory requirements for laboratory practice. The correct approach represents best professional practice because it prioritizes the validation of CGH data against established reference standards and clinical guidelines, ensuring the accuracy and reliability of the reported findings. This aligns with the CLSp, CG certification's emphasis on maintaining high standards of laboratory practice and contributing to patient care through precise diagnostic information. Specifically, it reflects the regulatory expectation that all laboratory testing, including advanced molecular techniques like CGH, be performed and interpreted in a manner that ensures patient safety and diagnostic integrity. This involves a thorough understanding of the limitations of the technology, appropriate quality control measures, and the ability to correlate findings with known genetic syndromes or disease states. An incorrect approach that relies solely on automated interpretation without independent verification fails to meet regulatory requirements for laboratory oversight and quality assurance. This could lead to the reporting of inaccurate or misleading CNV data, potentially impacting patient diagnosis and management. Such a failure would contravene the CLSp, CG, standards that mandate a level of expert review and validation of all diagnostic results. Another incorrect approach that neglects to document the specific CGH platform and analysis parameters used would violate the principles of good laboratory practice and traceability, making it difficult to reproduce results or troubleshoot discrepancies, which is a fundamental regulatory expectation. Furthermore, an approach that does not consider the clinical context or consult with a qualified geneticist or pathologist when interpreting novel or complex findings would be a significant ethical and regulatory lapse, as it bypasses essential collaborative steps in patient care and diagnostic interpretation. The professional decision-making process for similar situations should involve a systematic evaluation of the CGH data, including a review of quality control metrics, comparison with established databases and literature, and consideration of the patient's clinical presentation. When interpreting complex or ambiguous results, collaboration with experienced colleagues, geneticists, or pathologists is crucial. Adherence to laboratory standard operating procedures, SOP, and relevant regulatory guidelines is paramount at every step, from sample processing to final report generation. Question 17. The evaluation methodology shows a scenario where a postnatal patient presents with developmental delay, dysmorphic features, and a history suggestive of a specific genetic syndrome known to be caused by submicroscopic chromosomal imbalances. Which of the following approaches best aligns with current best practices and regulatory expectations for postnatal cytogenetic analysis in this context? Option A. Proceed with whole genome sequencing (WGS) to identify all possible genetic variations, as this offers the most comprehensive genetic information. Option B. Perform chromosomal microarray (CMA) analysis due to its ability to detect submicroscopic deletions and duplications, which are implicated in the suspected genetic syndrome. Option C. Initiate standard G-banded karyotyping to assess for gross chromosomal abnormalities, as this is a foundational cytogenetic technique. Option D. Prioritize rapid turnaround time by utilizing a FISH probe panel targeting common aneuploidies, as this is often the quickest method. The correct answer is B. Perform chromosomal microarray (CMA) analysis due to its ability to detect submicroscopic deletions and duplications, which are implicated in the suspected genetic syndrome. Explanation. The evaluation methodology shows a scenario where a clinical laboratory specialist in cytogenetics must determine the most appropriate method for postnatal cytogenetic analysis based on a patient's clinical presentation. This is professionally challenging because the choice of methodology directly impacts diagnostic accuracy, turnaround time, and resource utilization, all of which are critical in patient care and laboratory operations. Furthermore, adherence to regulatory guidelines for diagnostic testing is paramount. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the clinical indication to select the most sensitive and specific cytogenetic technique. In the context of postnatal analysis, this often involves considering the likelihood of specific chromosomal abnormalities based on the patient's phenotype. For example, if a microdeletion syndrome is suspected, a technique like chromosomal microarray (CMA) might be indicated due to its higher resolution for detecting submicroscopic imbalances, which are not detectable by conventional karyotyping. Regulatory frameworks, such as those governing laboratory testing in the United States e.g., CLIA regulations, emphasize the need for validated methodologies that are appropriate for the intended diagnostic purpose and are performed under qualified personnel. Selecting a method based on clinical suspicion and established guidelines ensures that the analysis is targeted and efficient, aligning with the principles of quality assurance and patient safety mandated by these regulations. An incorrect approach would be to solely rely on a single, broad-spectrum technique, like karyotyping for all postnatal indications, regardless of the specific clinical suspicion. This fails to meet best practice because karyotyping has limitations in detecting smaller chromosomal aberrations, such as subtelomeric deletions or duplications, which are increasingly recognized causes of developmental delay and congenital anomalies. Ethically and regulatorily, this could be considered a failure to provide the most appropriate diagnostic service, potentially leading to misdiagnoses and suboptimal patient management. Another incorrect approach would be to select a methodology based solely on laboratory throughput or cost-effectiveness, without adequate consideration of clinical relevance. While efficiency is important, it should not supersede the diagnostic needs of the patient. Regulatory bodies expect laboratories to offer services that are clinically validated and appropriate for the patient population they serve. Choosing a less sensitive or specific method due to cost or speed, when a more appropriate method exists and is indicated by the clinical presentation, could be viewed as a deviation from professional standards and potentially a violation of quality assurance requirements. A third incorrect approach would be to perform a cytogenetic analysis without a clear clinical indication or referral from a qualified healthcare provider. Cytogenetic testing is a specialized diagnostic procedure that requires careful interpretation in the context of a patient's medical history and physical examination. Performing such tests without proper justification not only wastes resources, but also can lead to unnecessary anxiety and follow-up for patients and families, and it deviates from the principle of providing medically necessary services as expected by regulatory oversight. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical presentation, a thorough understanding of the capabilities and limitations of various cytogenetic methodologies, and a review of current clinical guidelines and regulatory requirements. Collaboration with referring clinicians is essential to ensure that the chosen test is appropriate and that the results will be clinically actionable. Question 18. Research into the most effective method for reporting complex chromosomal abnormalities identified in prenatal diagnostic samples, considering the need for both precise scientific description and clinical interpretability within the context of established cytogenetic reporting standards. Option A. Developing a proprietary reporting template that prioritizes detailed technical descriptions of observed chromosomal variations, even if it deviates from standard nomenclature. Option B. Submitting a report that focuses solely on the presence or absence of common aneuploidies, omitting detailed descriptions of mosaicism or structural rearrangements. Option C. Employing the International System for Human Cytogenomic Nomenclature, ISCN, with clear, concise interpretive summaries tailored for the referring clinician. Option D. Providing a report that lists raw karyotype data without any interpretive summary or adherence to standardized nomenclature. Correct answer is C. Employing the International System for Human Cytogenomic Nomenclature, ISCN, with clear, concise interpretive summaries tailored for the referring clinician. Explanation. Scenario analysis. This scenario presents a common challenge in cytogenetics reporting, ensuring clarity, accuracy, and adherence to established standards when communicating complex findings. The professional challenge lies in balancing the need for detailed technical information with the requirement for a report that is readily understood by referring physicians and other healthcare professionals, while also meeting regulatory expectations for completeness and standardization. The CLSp, CG, must exercise careful judgment to select the most appropriate reporting format that aligns with current best practices and regulatory mandates. Correct approach analysis. The correct approach emphasizes the use of standardized nomenclature and reporting guidelines, such as those established by the International System for Human Cytogenomic Nomenclature, ISCN. This ensures consistency, comparability, and unambiguous communication of cytogenetic findings across different laboratories and institutions. Adherence to ISCN is a fundamental requirement for accurate and interpretable reporting in cytogenetics, directly impacting patient care by providing reliable diagnostic information. This approach reflects best professional practice by prioritizing scientific accuracy and regulatory compliance, facilitating effective interdisciplinary communication, and contributing to the overall quality of laboratory services. Incorrect approach is analysis. One incorrect approach involves creating a custom reporting format that deviates significantly from established international standards. This failure to adhere to ISKCON or similar recognized guidelines introduces ambiguity and can lead to misinterpretation of results by the referring clinician, potentially impacting diagnostic decisions and patient management. It represents a significant regulatory and ethical failure, as it compromises the standardization and quality assurance expected of a CLSp, CG. Another incorrect approach is to provide a report that is overly technical and lacks clear interpretation for the non-cytogeneticist. While technically accurate, such a report fails to meet the practical needs of the clinical team, hindering their ability to integrate the cytogenetic findings into patient care. This approach, while not necessarily violating specific nomenclature rules, fails to meet the ethical obligation of clear communication and effective service delivery. A third incorrect approach might be to omit critical information, such as the specific methodology used or the quality of the analysis, from the report. This lack of transparency can undermine confidence in the results and prevent proper evaluation of the findings. It represents a failure to meet the comprehensive reporting requirements mandated by regulatory bodies and professional standards, impacting the integrity of the diagnostic process. Professional reasoning. Professionals should approach reporting by first identifying the specific regulatory framework and established nomenclature guidelines applicable to their jurisdiction and practice. They must then consider the intended audience of the report and ensure that the findings are communicated clearly and accurately, using standardized terminology. A systematic review of the cytogenetic data against established criteria, followed by a structured report that includes all necessary components, is essential. When in doubt, consulting with senior colleagues or referring to updated guidelines is a critical step in ensuring the highest standard of professional practice. Question 19. System analysis indicates that a CLSp, CG, performing cytogenetic testing for a suspected inherited disorder identifies a chromosomal abnormality that is not directly related to the presenting symptoms, but is known to be associated with an increased risk of certain adult-onset conditions and potential reproductive implications. What is the most appropriate course of action for the CLSp, CG in this situation? Option A. Immediately report the incidental finding to the referring physician without further assessment, assuming it is clinically relevant. Option B. Document the incidental finding but do not report it, as it falls outside the scope of the initial diagnostic query. Option C. Conduct a risk assessment to determine the clinical significance of the incidental finding and consult with the referring physician or a genetic counselor regarding reporting and patient management. Option D. Proceed with reporting the incidental finding directly to the patient, bypassing the referring physician and genetic counseling. The correct answer is C. Conduct a risk assessment to determine the clinical significance of the incidental finding and consult with the referring physician or a genetic counselor regarding reporting and patient management. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the CLSp, CG to balance the immediate need for accurate diagnostic information with the potential for incidental findings that may have significant implications for the patient and their family, but are outside the scope of the initial diagnostic query. The CLSp, CG, must navigate the ethical considerations of reporting or not reporting such findings, adhering strictly to established laboratory protocols and regulatory guidelines for cytogenetic testing. The complexity arises from the potential for a finding to be clinically relevant but not directly related to the presenting symptoms, necessitating a careful risk assessment and communication strategy. Correct approach analysis. The correct approach involves a thorough risk assessment that considers the likelihood of the incidental finding being clinically significant and the potential impact on the patient's health and reproductive choices. This aligns with the principles of responsible laboratory practice and patient-centered care, as mandated by regulatory frameworks governing genetic testing. Specifically, it requires adherence to laboratory policies and procedures for handling incidental findings, which often involve consultation with clinical geneticists or genetic counselors to determine the appropriate course of action regarding reporting and patient counseling. This ensures that the patient receives comprehensive care and informed decision-making, while the laboratory maintains its professional and ethical obligations. Incorrect approach is analysis. One incorrect approach is to immediately report all incidental findings without a prior risk assessment or consideration of the patient's consent for such reporting. This violates ethical principles of patient autonomy and can lead to unnecessary anxiety and medical interventions for findings that may be benign or of uncertain significance. It also potentially contravenes regulatory requirements that may stipulate specific protocols for reporting incidental findings, especially those with implications for future health or reproductive risks. Another incorrect approach is to ignore or discard incidental findings that are not directly related to the initial diagnostic query, even if they are potentially clinically significant. This failure to identify and act upon important genetic information can have serious consequences for the patient's health and that of their relatives. It represents a dereliction of professional duty and a potential violation of laboratory quality standards and regulatory oversight that expect comprehensive analysis and reporting of relevant findings within the scope of the test performed. A third incorrect approach is to unilaterally decide to report an incidental finding without consulting with the referring physician or a genetic counselor. This bypasses essential communication channels and deprives the patient of expert guidance in understanding the implications of the finding. It also risks misinterpretation of the results and inappropriate patient management, which is a failure to uphold the collaborative nature of patient care and the regulatory expectation for appropriate communication and consultation. Professional reasoning. Professionals in this field must adopt a systematic decision-making process that begins with understanding the scope of the ordered test. When an incidental finding arises, the immediate step is to consult the laboratory's established protocols for handling such situations. This typically involves a risk assessment to determine the potential clinical significance of the finding. Following this, collaboration with the referring physician and, if necessary, a genetic counselor is crucial to ensure appropriate patient counseling and management. This multifaceted approach prioritizes patient well-being, ethical conduct, and regulatory compliance. Question 20. Benchmark analysis indicates that a routine prenatal diagnostic sample reveals a complex, apparently balanced chromosomal rearrangement involving paracentric inversion of chromosome 10 and a reciprocal translocation between chromosomes 4 and 11. The referring obstetrician has provided minimal clinical information, stating only advanced maternal age. As a CLSp, CG, what is the most appropriate course of action to ensure accurate and clinically relevant reporting? Option A. Document the chromosomal findings accurately but refrain from any interpretation of clinical significance, as the information provided is insufficient to make a definitive assessment. Option B. Conduct a thorough literature search for reported cases of paracentric inversions of chromosome 10 and reciprocal translocations involving chromosomes 4 and 11. Consult with senior cytogeneticists and clinical geneticists to assess the potential clinical significance and risk of unbalanced rearrangements in future pregnancies, and provide a detailed report to the referring physician outlining these findings and their implications. Option C. Report the findings as balanced rearrangement, likely benign given the absence of obvious phenotypic abnormalities in the fetus at this gestational age and the limited clinical information provided. Option D. Immediately inform the referring physician that the fetus is at high risk for developmental delay and congenital anomalies due to the complex rearrangement, without further investigation or consultation. The correct answer is B. Conduct a thorough literature search for reported cases of paracentric inversions of chromosome 10 and reciprocal translocations involving chromosomes 4 and 11. Consult with senior cytogeneticists and clinical geneticists to assess the potential clinical significance and risk of unbalanced rearrangements in future pregnancies, and provide a detailed report to the referring physician outlining these findings and their implications. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in cytogenetics, interpreting a novel or complex chromosomal abnormality and communicating its potential clinical significance to the referring physician. The challenge lies in bridging the gap between raw cytogenetic findings and actionable clinical information, especially when the abnormality is not a well-established syndrome. The CLSp, CG, must synthesize information from various sources, consider the limitations of current knowledge, and provide a nuanced interpretation that guides further clinical management without overstating or understating the potential implications. This requires a deep understanding of genotype-phenotype correlations, the variability of expression, and the ethical imperative of accurate and timely reporting. Correct approach analysis. The correct approach involves a thorough literature search for similar reported cases, consultation with experienced cytogeneticists or clinical geneticists, and a comprehensive assessment of the abnormality's potential impact on gene dosage, gene disruption, or chromosomal instability. This approach aligns with the CLSp, CG's responsibility to provide accurate and clinically relevant interpretation. It adheres to the principles of good laboratory practice, which mandate that all findings be interpreted in the context of the patient's clinical presentation, and that reporting be clear, concise, and informative. Furthermore, it reflects the ethical obligation to ensure that diagnostic reports contribute meaningfully to patient care and decision-making by providing the most up-to-date and relevant information available. Incorrect approaches analysis. One incorrect approach is to dismiss the abnormality as benign without sufficient investigation, simply because it is not a commonly recognized syndrome. This fails to meet the professional standard of care and could lead to misdiagnoses and delayed treatment for a patient who may have a rare but significant condition. It also violates the principle of thoroughness in diagnostic reporting. Another incorrect approach is to definitively assign a specific syndrome or prognosis based on limited data or speculation. This oversteps the boundaries of diagnostic interpretation and can lead to misinformed clinical decisions, causing undue anxiety or false reassurance for the patient and family. It represents a failure to acknowledge the inherent uncertainties in interpreting novel findings and a departure from evidence-based reporting. A third incorrect approach is to report the finding without any attempt to contextualize its potential clinical significance or to suggest further avenues for investigation. This renders the report less useful to the referring physician and fails to leverage the CLSp, CG's expertise in interpreting complex genetic data. It represents a missed opportunity to contribute to comprehensive patient management and a potential deviation from the expectation of a clinically integrated report. Professional reasoning. Professionals in this field must adopt a systematic approach to interpreting chromosomal abnormalities. This begins with a meticulous review of the cytogenetic data. Subsequently, a comprehensive search of relevant databases and literature is crucial to identify any previously described similar findings and their associated clinical phenotypes. Consultation with colleagues, particularly those with expertise in clinical genetics or dysmorphology, is invaluable for gaining diverse perspectives and refining the interpretation. The CLSp, CG, must then synthesize all available information, considering the specific chromosomal region involved, the type of rearrangement, and the potential functional consequences. The final report should clearly articulate the findings, discuss their potential clinical significance based on current evidence, acknowledge any uncertainties, and suggest appropriate follow-up investigations or consultations. This iterative process of data review, research, consultation, and synthesis ensures that the interpretation is robust, clinically relevant, and ethically sound.